University of Michigan Health West has been under new leadership for just over 2 months. A doctor with a track record of medical inventions and renowned success.
Community Affairs Director Casey Jones walked the hospital with the new president to see the direction it's headed.
And we're going to go left again.
As Dr. Ron Grifka makes his way through the veins of University of Michigan Health West.
You having a good day?
I'm having a great day.
There is one beat abundantly clear.
No football games this weekend, huh?
He has the pulse of the people in this place.
Okay, give me 5.
And that charts. As the new president of the hospital, he is at the heart of it.
You know, I round in the hospital several days a week, trying to get us from the emergency room to the intensive care unit to the newborn nursery, trying to see all the doctors and nurses and technicians and therapists. And it's nice to hear their challenges, also hear their successes.
Grifka has always led with the heart. It's why he got into medicine in the first place.
My older brother had Down syndrome. I always thought that the doctors who took care of my brother and talked to my parents thought they could have done a better job.
And it's the heart that's been the center of his career as a cardiologist for the last 35 years.
I was fortunate to work at some great places. I spent most of my career at Texas Children's Hospital in Houston. It's 22 stories, 800 beds. It's a big place. It's been number 1 or 2 in cardiology for the last probably 30 years, but they really drilled into you the importance of doing things right. I was doing a heart catheterization on a newborn baby and had a very severe heart problem. And I was talking to the parents about the procedure and going over the risks and the complications, and it just struck me, you know, the most important possession they have in the world is this little child. And they're trusting it to me to do this very kind of risky heart catheterization procedure. And they didn't care how many papers I'd written, how many lectures I've given, where I was a visiting professor. They just wanted one good procedure.
There are thousands of patients who've received one good procedure from Grifka. He's got the drawer full of cards to prove it.
Here's Dr. Grifka.
And now that's the mantra he's working to instill as the leader at U of M Health West.
To really be successful, you have to really do a good job when that day you're not on your game. But I think making sure you're just paying extra attention, real careful, to make sure every day you're providing the same level of care, same quality. And that's what we're going to shoot for here at U of M Health West.
It's the direction they've taken to heart. The new open heart surgery program is already outpacing expectations, and there are more changes with Grifka in charge on the horizon.
Probably 10 years ago, mostly primary care type of hospital, but now we brought in a number of specialists with the, trauma surgery, cardiac surgery, advanced heart failure, endocrinology. We're really excited about where we've been and even more excited about where we're going.
From where he came from, the corner of Gratiot and 6 Mile in Detroit, to where he is,
I think he's in his little cubbyhole.
Grifka has always dreamed of being a part of the Block M. From his time at CS Motts to now the president at U of M Health West.
It's nice to see the partisanship. We need to get rid of some of these, though.
Those dreams are lived every day and passed through to his team and his patients that sit on his heart.
I'm just working on the foundation built by other people who set up a great health system, and in conjunction with our colleagues in Ann Arbor, it's really been just a rewarding experience to help take care of patients here at U of M Health West.
For News 8, I'm Casey Jones, connecting with community.